Good morning, and thank you for joining us. My name is Tiffany Dutes, and I'm a Community Outreach Specialist in the Communications and Outreach Department at Jackson Health System. Welcome to the UHealth Jackson Urgent Care Talk, led by Dr. Robert Schwartz, Professor and Chair of the Department of Family Medicine at the University of Miami, Miller School of Medicine, Chief of Service of Family Medicine at Jackson Memorial Hospital, and Medical Director of UHealth Jackson Urgent Care. Today's topic will be Feel Safe Coming to UHealth Jackson Urgent Care. If you have any questions you would like to ask Dr. Schwartz, please add them to the chat and he'll do his best to answer them at the end. Thank you. Dr. Schwartz.
Good morning, everybody. I'm delighted to be here and welcome you to the chat. This is the first of hopefully many chats that we're going to have with the community. These are difficult times. During this pandemic, we've seen a nationwide trend of decreased visits to urgent cares and hospital emergency rooms. It's completely understandable. We understand that the anxiety and fear that some people have about coming into contact with a virus, especially in a hospital situation or an urgent care, certainly heightens everybody's concern. But I'm here to tell you today that our hospitals and facilities are extremely clean and safe, and I'm going to give you some details. Before I do that, I just want to let you know that I don't want to spend all the time talking myself. I want to open it up relatively quickly to your questions, and hopefully I can answer those and help to some degree allay your concerns about the healthcare system at Jackson and the university. So some of the things that we're doing in our urgent care center and the changes that we made, for example, our waiting areas are limited to one person at a time. All the patients are asked to wait in their car in the parking lot outside the urgent care, and then they're called in one by one. All of this is to maintain social distancing. All of our staff are wearing full personal protective equipment. I'm sure you've heard of the term PPE. That's what it means, and it includes wearing masks, face shields, gloves, and when appropriate, gowns that protect them and also the patient and attempt to prevent transmission of the virus. Face masks and hand sanitizer are available to all of the patients, and we require everybody to wear a mask. As a matter of fact, many patients come in with their own mask, and we ask them to take off their own personal mask because we don't necessarily know how clean those are, and we provide you with the mask so that we're sure that you're protected and the staff are protected at the same time. All the rooms after a patient has been in that room are thoroughly disinfected. Each room, the surfaces are wiped down, and when appropriate, misting occurs in those rooms. We take the temperature of all of our patients and ask a series of appropriate questions. Where have you traveled to? Have you been near anybody that's been sick or had a positive COVID-19 test? Have you been in a hospital, or have you been out in a restaurant, et cetera, unprotected? And we'll talk a little bit more about some of the ways that you can protect yourself, even though I'm sure many of you have seen what goes on TV and perhaps even in your own communities, and you've seen that people are walking around without masks and perhaps without gloves and not taking precautions. And unfortunately, I think at this particular moment in time, that's not the greatest way to protect yourself and your families. Let me say a little bit about our clinics and our physicians. They're staffed by residency trained and board certified family doctors. Family medicine is a very broad area. Some of you might remember Marcus Welby. Well, family medicine is still alive and well here in Miami and of course in the United States. And family doctors are trained to take care of children, adolescents, adults, women's health, the elderly. They're also trained in what's called the biopsychosocial model. So when people have anxiety and depression and other conditions like that, they're well equipped to take care of those problems in the urgent care center. So I think that the type of care that's provided there, along with our excellent staff who are all Jackson employees and vetted very carefully for their skill sets, certainly is part of of what we do to make sure that we provide you with the best health care possible in a very safe setting. Now, of course, anybody with a medical emergency or an acute problem, such as chest pain, sometimes an urgent care center is not the appropriate place. An older person with chronic illness who suddenly develops chest pain or slurred speech, that would be something that one would want to direct to an emergency room and not necessarily to urgent care. We do have the ability to evaluate patients with acute care symptoms, but if the physician determines that somebody is having an imminent heart attack, obviously we would transfer that patient to one of our hospitals, either Jackson South, either Jackson Main in downtown Miami, or Jackson North, depending on where that person lived. Of course, the things that are treated in urgent care are a broad range of symptoms. Somebody with an ear infection, somebody with a sore throat, somebody with an unrelenting upper respiratory infection, people who've cut themselves in the kitchen with a knife to broken bones are all treated quite effectively in the urgent care centers. We have a full range of services. We have radiology services at all of our centers, and we have backup and an immediate ability to communicate with our subspecialist physicians at Jackson and at the university. So I'm just going to mention a little bit about what's going on nationally, and I think that most of you, if you're looking at the news or reading the newspaper or even listening to the radio, realize that the numbers of patients who have contracted COVID-19 has gone up. I think the unfortunate number I heard this morning was that more than 2 million people in the United States have contracted it. The important thing to realize is that not everybody that contracts the virus actually becomes ill enough to have to go to the hospital and wind up in an ICU. And I'm sure many of you have questions about that, and we certainly can discuss that in more detail. The important things to remember are that face masks really have value. It's important to protect you from other people, and of course, to protect you in a group of people. But hand washing, the simple act of washing your hands with soap and water after you touch things, a doorknob, a car door, you're in a restaurant and you touch the counter, you're in the supermarket and touch the machine that you put your credit card in, or hand something to somebody. All of that can be helped by using hand sanitizers and just the simple act of washing your hands. There's been a lot of discussion about using Clorox and other disinfectants like that, and it's absolutely not necessary to do, and sometimes can be dangerous and often cause problems with skin-related issues. So I'm going to stop here for the moment, and let's see what kinds of questions there are. I'm going to turn it back over to Tiffany, and I'm happy to field your questions.
Thank you, Dr. Schwartz. So our first question that we do have, if I'm experiencing cold-like symptoms, when should I treat myself at home with over-the-counter medicines? And when should I go to an urgent care center or ER? When should I be concerned that it could be the coronavirus?
Right. So that's a question that many people have, and the current thinking is it really depends on your prior state of health. So somebody who has a heart condition, somebody who has poorly controlled diabetes, somebody who might have chronic obstructive pulmonary disease or has multiple medical problems, one has to be much more cautious than if you're healthy and don't take a lot of medications or don't have underlying illnesses. So the usual symptom with the coronavirus is when it does become active is people develop a fever. You often sometimes have a dry cough, although that's been shown not necessarily to be an absolute indicator of the infection. People do develop other flu-like symptoms. It's important to remember that COVID-19 is part of a group of viruses called coronaviruses. And they're actually the viruses that cause common cold, and they've been around for centuries. So this is, although the COVID-19 seems to be a much more aggressive virus, it's still part of a family of viruses that cause symptoms like muscle aches and pains, diarrhea, abdominal pain, etc. So the way to treat it at home, as long as you're not developing worsening symptoms, would certainly be to take Tylenol if you have a fever, drink plenty of fluids, preferably stay well hydrated. Sometimes resting and sleeping is a good way to help your body deal with the virus. However, if those symptoms seem to get worse and you're more uncomfortable or you're short of breath, then that would be the time to go to urgent care center and be tested and evaluated for your condition. A simple chest x-ray can show that the COVID-19 virus is infecting your lungs to a point where you might need hospitalization.
Thank you, Dr. Schwartz. So our next question that we have is, now that COVID antibody test is widely available, should I get tested? Are there any benefits in getting tested?
That's a very good question, and it's a bit controversial. Certainly the antibody test will demonstrate that you have been exposed and that your body has developed antibodies to it. It doesn't necessarily mean that you are protected in the long term from getting reinfected. We scientifically, we haven't yet had enough information and research to demonstrate that if you're antibody positive, you're necessarily out of harm's way. For many people, it's reduces their anxiety to know that they don't have the antibodies. To some degree, it's useful in the sense that it'll make you aware that you need to be much more careful than if you were antibody positive. Sometimes there's value in knowing that you're antibody positive because you could become a serum donor. It's been shown that taking serum, which is the liquid part of your blood, and putting it back into patients who are severely ill with COVID-19 actually do better. Those antibodies from someone else can help boost the response in somebody who is in the hospital in an ICU. So I hope I've answered the question. It's not necessarily an easy question to answer. It depends more on your own comfort level.
Thank you, Dr. Schwartz. So our next question is, some urgent cares are specifically for kids. Are the UHealth Jackson urgent care centers able to treat kids?
Yes, so as I mentioned, the physicians who are working in our urgent care centers are all board certified trained family physicians. And family doctors, as part of their residency training, all are capable of evaluating children. Many of our residents in training actually train in obstetrics and would even be able to handle a patient who walked in labor if that were the case. It's not necessarily the best place to deliver, but they certainly would be trained to do that. So the answer is yes, children of all ages can be treated at the urgent care centers.
Thank you. Our next question is, my child is autistic and has special needs. Is the urgent care staff trained to help kids like mine?
Very good question. And we have just completed a training program for our physicians and staff for autistic children. So yes, we are a designated center that is absolutely capable of treating autistic children. It takes patience, it takes understanding of autism, and we are all sensitized to taking good care of autistic children.
Thank you. And our last question that we have is, there are a lot of different urgent care centers. What makes UHealth Jackson Center different?
We currently have 5 urgent care centers, and at the end of the webinar today, you will see a slide with all of the addresses and the directions and phone numbers of our urgent care centers. And I guess perhaps I'm a bit biased, but what makes us different is that we are affiliated with the University of Miami. We have very well-trained physicians, we have an excellent staff, and we have the ability, when patients need referral to the hospital or need expert subspecialty care, we have the ability to directly send those patients to those physicians and to our hospitals. So I think the level of care that we provide is really outstanding. Not that you can't get care in the community, but I think the relationship between the university and Jackson is something special in our Miami community.
Thank you, Dr. Schwartz. So that was our last question. Do you have anything else you want to add on before we end today's webinar?
Well, I guess I will repeat myself by saying that the pandemic is not over yet. And despite what is being touted in national politics and what people see on TV and people crowding the beaches and not wearing masks, I think that's an unfortunate perception of the fact that the virus is still here in the community. It's still very contagious. And I implore people to continue using their masks, doing hand washing, and maintaining social distance. It doesn't mean that you have to stay locked up in your home. I don't think our society is going to tolerate that much longer, but getting out and exercising, taking care of yourself, taking care of your mental health. If you're anxious or depressed, certainly seek health care and advice from your physician or from one of our urgent care centers. But remember, the pandemic is not over. And to be honest, only you can take care of yourself better than anyone else. And of course, members of your family. So that is my hope. And I thank you very much for attending.
Thank you, Dr. Schwartz. So I want to share some information about our urgent care centers with you all, so that you can know our different locations throughout Miami-Dade County, as Dr. Schwartz already said earlier. So thank you again for joining us for today's Doc Talk. We are here to serve you at one of our 5 convenient locations throughout the Miami-Dade County area. We invite you to visit our website, which is www.jacksonurgentcare.com. Please be sure to sign up for our next Doc Talk that's going to be taking place for the Doral Chamber of Commerce on June 19th, where we'll be discussing the difference between urgent cares and ERs. So we look forward to talking to you all again, and we look forward to taking care of you at one of our centers. Thank you.